Hello to everyone. First of all, we would like to thank you, the organization, for this very interesting and fruitful conference. The following communication is entitled Effectiveness of Personalized Intervention on Phonological Awareness, Alphabetic Principle, and Rapid Automatic Naming in a Bilingual Child with Reading Difficulties, whose authors are Dr. Juana Muñoz, Laura Herrera, and Dr. Dunia Garrido, all from the University of Granada, Spain. Despite extensive research, the prevalence of reading difficulties remains high. What is more, in the 2020 school year, a total of more than 102,000 students in Andalusia had SEN or special needs, which means more than 7% of the total student population. Most of these students were enrolled in primary education, around 43%, of whom more than 36,000 students had learning difficulties. This percentage also includes foreign children who have difficulties due to the change of language and even due to the lack of language skill of those parents who cannot adequately support their children in the face of learning to read. So that the process of literacy becomes a problem for many of these children, to which in many cases, unfortunately, is added to the risk of social exclusion. In response to this high incidence of reading difficulties, research in recent years provides important evidence of effective intervention for reading difficulties. In this sense, phonological processing skills are important predictors of reading success, including phonological awareness, phonological memory, and rapid automatic naming, RAN. According to the National Reading Panel in 2000, the basic elements that need to be trained for effective learning to read are phonological awareness, alphabetic principle, automatic word recognition, include prosody and fluency, vocabulary, and comprehension. Therefore, it seems that phonetic methods are the most effective for learning to read and intervening in reading difficulties in Spanish language. However, because reading difficulties are highly heterogeneous, scientific evidence provides the main instructional keys to making these phonological interventions effective. First, instruction should be explicit, direct, individualized, and focused on the reading level of each individual. Many and varied practice opportunities with graduated levels of difficulty must be provided too. Progress and responses should be closely monitored to identify difficulty profiles and to plan new interventions. In addition to this principle, the National Reading Panel concluded in this study that the use of computer programs using software could be effective as an intervention for literacy skills, particularly in those programs that include phonological awareness, training, word processing, and letter manipulation, among others. Based on the above, the objective of our study focuses on the implementation of an intervention program for reading Spanish as a second language for a foreign child at risk of social exclusion whose native language is Arabic. That is done using a computer program called Inventa Palabras, which we can customize and create new activities from scratch to train all levels of phonological awareness, RAN, and training of the alphabetic principle, grapheme-phoneme association. As mentioned above, these are activities that have been scientifically proven to be effective for learning to read and treating reading difficulties. Regarding the methodology, was an 8-year-old boy in his second year of elementary school who had been attending school in Spain since the age of 5. His native language was Arabic, and his cognitive level was considered as average. In terms of socioeconomic and cultural level, his family can be classified as low and is therefore at risk of social exclusion. In addition, his parents cannot read Spanish. Regarding the difficulties identified at school, difficulties in reading and writing are identified due to learning delays, and difficulties in keeping up with academic requirements were detected too. The assessment was carried out in a room assigned by the non-governmental organization called Aldeas Infantiles SOS, and the standardized tests include the evaluation of metalinguistic skills, the evaluation of phonological knowledge, and a screening of dyslexia. Additionally, a non-standard evaluation was included too. Specifically, the reading of letters, syllables, letter sounds, and both consonant vowel and consonant vowel consonant syllables were evaluated using the Inventa Palabras software. The procedure of this study was approved by the Ethics Committee of the University of Granada, the teacher, and both parents of the child. Parents were informed of the entry protocol, both the assessment process and the intervention, and they gave informed consent before the child was enrolled in this study. This study follows a longitudinal A/B single case design, quasi-experimental design, that includes several measures at the beginning of the study called phase A, and their development during the speech therapy treatment called phase B. The design was chosen for its applicability in the clinical setting. The duration of the intervention was 2 days per week, with sessions of 45 minutes approximately, and a total of 21 sessions, 7 for the evaluation, pre and post-evaluation phases, and 14 including in the intervention phase. In the following are some examples of the activities designed in this intervention program. regarding the results obtained after this intervention, first, the change in THM scores indicate an improvement in syllable deletion, syllable completion, and isolated joining and counting of phonemes, with a remarkable positive development. On the other hand, we can observe that this child keeps his ability of syllable segmentation and rhythm. Second, improvements were made in each of the areas assessed, with more than 36 improvement in syllable awareness and 73 improvement in phonemic awareness. Third, in the prolepsia test, very great difficulties were observed in each of the subtests and pre-tests. It was even impossible to perform the subtests requiring alphabetic knowledge in spelling and reading and writing in dictation. In the RAN of colors and objects, errors and a very slow access speed to the lexicon in relation to the age were observed too. The result obtained at post-test show an improvement in each of the assessed components, both in the execution time of the task and in the RAN, where the time and the errors committed decreased compared to the results of the pre-test. Finally, in the non-standardized evaluation, we observed how the participant made errors in knowing the letter in the pre-test phase. The errors and the improvement after the intervention can be observed in the post-test phase. In terms of reading direct and indirect syllables, greater difficulty was observed for clustered and reverse syllables and for the graphemes G, double L, and C. The most frequent error made during the evaluation was substitution, although addition and inversion could also be observed. Finally, regarding the RAN, slight changes were observed both at the level of execution and at the level of speed. In the post-test phase, there was an improvement in execution as no errors were made, and also the time to complete the activity was shorter, indicating an improvement in naming speed and the access to the lexicon. In summary, the program appeared to help participants in improving some variables, although many of them did not achieve statistically significant results, but there were positive changes that were remarkable in the clinical observation. The training was conducted for 2.5 months, which was not enough for the complete acquisition of the phonological processes, but the alphabetic principle was fully acquired, which is very important for the acquisition of the other skills that affect the acquisition of reading. The results support that individualized and personalized literacy intervention based on the phonemic method, working not only on phonological processing, but also on the other processes such as RAN, achieve positive changes in improvement in the skills training during intervention. Implications for children and families are that kids are usually good at learning new language. So if you move to another country, your young child should have no trouble learning this new language. However, if you are concerned about your child's reading difficulties, even though his or her oral language is good, consult a communication specialist, such as a speech-language pathologist. Implications for practitioners are that it is worthwhile to make an assessment of the type of syllable structure errors that emerge from both standardized and non-standardized tests. This will help you individualize the intervention. Reading difficulties are very heterogeneous, so the intervention should use an individualized approach that is adaptive to each child. And that's all. Thank you for your attention.